Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm also the inventor of advanced soft tissue release ASTR specialty. I am a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty.
Right, Chris, tell me what's going on with your elbow.
Just problems with the tendonitis in my inner elbow. I have pain when I use it for, say, curls or any kind of motion pulling up, stuff like that.
How long has this been going on?
A little over a year and a half.
Year and a half. Okay, can you tell me what kind of treatments you had before coming here?
I've done chiropractic, I've done physical therapy. I've done numerous cortisone shots.
Okay, how many cortisone shots?
About 5.
5, okay. So, how much pain do you feel there from 0 to 10?
About 6.
6. And the motion that aggravated curls?
Any kind of curl mode or any kind of pulling with my elbow or pushing up. So yeah, curl motion.
Alright, so let's do the motion that aggravated and tell me how much pain with that.
So right now maybe like a 4. Right when I pull about right here is where I feel it.
So where do you feel it?
The inner elbow.
The inner elbow. Okay, so I'm gonna actually take the range of motion for that limitation and then we'll do the treatment.
It's not the best position for the range of motion.
Yeah, I'll come closer.
Yeah, but we'll try to squat nice and tall. We'll get the side view for the range of motion. Okay, bend your elbow.
Oh, bend it.
So that's when you feel it?
Right there, about right there.
About, yeah.
But I just want to pull my wrist like this.
Oh, sorry. Okay. So this is, it's about 120. 120 here. Okay. Stretch your elbow. How much pain did you feel there?
That's where I feel it. It's tight when I stretch it.
Stretch it here. So that's minus 10. So minus 10 and 120. Okay. Alright. And it's localized there or it's going down?
No, mostly localized.
Mostly localized. So you tried everything under the earth now.
I tried everything.
It's 120.
120 flexion, extension minus 10. Okay. So let's roll this up. You feel pain here? Where is this spot?
Right in here.
Right in here?
A little higher.
Here?
Right.
Yeah, I feel that scar tissue.
Is that what it is?
Yeah, that's scar tissue. You have more here too. And you have it here. You feel this bump
that feels
here?
tight, yeah.
Yeah, that's a scar tissue.
That's scar tissue?
Yeah. You should not have this like
No,
rock
okay.
there.
I do feel it there, yeah.
That should not be there. And you have it here. You have it all over. So do you remember how did you hurt your elbow?
I believe from doing curls.
Yeah.
That's how it started.
A lot of like overtraining.
The overtraining, yeah. Curls.
Yeah. So it's gonna feel cold, okay?
Okay.
So that's been going on for a year now, yeah?
Over here. Here.
Is that too much?
No.
Okay.
No.
And did you have any other injury? What other past medical history you have, like surgeries?
5 different neck surgeries for neck fusion.
Fusion, what levels?
C5, 6, and 7.
Okay. You feel this bump here? That's scar tissue.
That's great that you did.
That's stuck.
Yeah.
Stuck.
So I have it all over.
Yeah.
I swear.
Did you do a lot of typing?
No. This is weird.
Mm-hmm.
Yeah, I really feel it there.
You feel that's good. It's actually not allowing the insulin to go through. Just
Yeah.
painful. Make sure it's not painful.
No, it's not terrible. So for to heal it, you really need to Get the scar tissue, break the scar tissue.
Yeah, but the thing is, you don't want to feel pain while I'm breaking it because there's fine line between breaking scar tissue and causing scar tissue. If you're causing trauma, you start the healing cycle again. You start inflammation, proliferation, and maturation. That's why I don't want you to feel pain because that's going to be opposite to what we try to do. You know,
it's very informative.
Yeah. Well, that's why I disagree with the philosophy, no pain, no gain. I'm like, if you feel pain, God gave us that pain signal as it's similar like check engine signal in your car.
Right.
So when you have that signal, you have two options. One, either you cover the signal and keep driving, or two, fix it and the signal will disappear by itself. So we don't want to push the pain. We want to investigate why you have the pain, relieve it, so things will be corrected. But you can see, and also here, look here. You see this redness?
Yeah, I see.
That's all scar tissue. Yeah. So, and you remember this bump here that prevent me from moving? Do you feel it now?
It's starting to break up, it seems like.
Yeah, it's moving.
Mm-hmm.
Before it was like a stuck here. It's not moving. Yeah.
Right.
See?
Doesn't feel as bad.
Yeah, it's going
It's
just
tight.
one straight line. Yeah, before it was like I just stuck here. It's not really going further.
It's rare, right?
Yeah, that's all the scar tissue. See the line here? Even though I did the other area, but it's not. So I'm gonna get here. Is that too much here?
No. You know, another doctor told me this because I always felt other, pain in the middle of the forearm as well. And I was treated just one area where I said it was hurting.
Well, when we understand the body, there's a referral pain and there's also fascia system that's wrapping the entire body that there's no beginning or end for it. So the treatment, you cannot focus in here because this could be compensation for something else,
So part of this could be causing some of this, the pain? In the area?
Yeah, you see the scar tissue because you have the two muscles in the front and the back. When one contract, the other one should be relaxed. So if you don't have the full length in both of them, it's gonna affect the contraction. It's like it's like a two poles. You have to have those muscles work synergically. Let me actually. So I'm gonna dig in. You can come this way.
Yeah, that's where it is.
Sorry. Okay.
No, but that's what's
So
happening.
that's what I'm gonna get to that. Feel that here?
Yeah.
And you can hear it actually. Yeah, and you can hear the scar tissue. It's like a washing board. Feel that?
Okay.
Here. Can you hear
I
that?
can't hear that.
No? Say yes. Oh, yeah. Okay, so we are hearing it. Good. And all this muscle connected to your elbow.
So this has probably been going on longer than a year and a half then, with inside, no?
I think you had a lot of repetitive strain injury that you just got the scar tissue.
So that works.
Yeah, if you don't know like a certain events that really like accident or trauma usually happen.
This is orthopedic. How can I help you? This is specific orthopedic, Dr. Christopher Lynn's
Okay,
office.
so I want you to turn out like this.
With Cynthia.
Make sure it's not painful.
It's not painful, it's just tight.
Okay. Make sure you breathe, okay?
Okay.
We want you to breathe here, okay?
I like to
How can I
breathe.
help you?
Yeah, just make sure that you don't mind.
Pacific Orthopedic, Jackson speaking.
Okay, I'm gonna lift it up like this.
Okay, what's the date of birth? The date of birth?
Why do you think I got it more on the right than the left? Why do you think I got it mostly on the right and not on the
Probably you
left?
had a lot of repetitive motion that you
On
strained
one
the other side. You
Or it's using this muscle more?
Yeah.
I
So
feel it there, yeah.
too much?
No.
You see
I
the
feel the
redness?
scar tissue.
1 second más,
Feel
descarga,
there?
¿ok?
Do you feel it?
Creo que es
No.
Oh, the correct answer is yes.
Déjame transferir la llamada.
Start to
con
let you
Cecilia.
feel all that. It's not painful, isn't it?
No.
Okay.
Dame un momento.
Yeah, you can see.
How red it
Okay.
is.
So let's try it again.
Feels better.
0 to 10.
Hey, Sophia.
I don't right now. I don't feel the pain.
Just relax. You can feel it. So in the mess.
Yeah, okay. Yeah, she's
Feels even looser.
Yeah, that's when the scar tissue break down, so they're not released. So you're able to stretch your pain because those muscles are not fully contracted because the scar tissue is in the way. Okay, so extend it again. Let's take the range of motion.
Okay.
Remember the numbers? 120 and minus 10.
Would that work for the neck as well?
Yeah.
It doesn't.
Well, for example, you had those fusion in your neck. So part of your body healing, you have to have a scar tissue. Otherwise, it's going to be open now.
Yeah.
Yeah, it's going to be open wound. So straight your L. Okay, that's 0. It was minus 10.
Minus 10.
Yeah, bent. That was 120. Now, can you see it? There you go. It's 132. You see that? Okay. Yeah, it's like 4 range of motion. Any pain, discomfort?
No, not right now. It seems alright.
Yeah. So, what do you think about ASTR treatment?
So far, it works great.
Yeah. Awesome. Yeah.
I like it.
Yeah, I'm good.
I want to be out of pain. It's better than getting a cortisone shot. that's
Yeah,
for
yeah,
sure.
yeah.
It's only temporary. I'm looking for, permanent
Well,
solution.
cortisone shot is not gonna break the scar tissue.
Yeah.
You know? So, but we have to work on the scar tissue, especially when you have golf or
Uh-huh.
because that's usually a lot of scar tissue in that area. That's restricted the range of motion.
Okay, cool.
All right, awesome. Thank you. Thank you. Feel free to subscribe to my channel to get updates about helpful information and tips and tricks on how to relieve your pain and your patient pain. Also, there's over 170 videos, most of them actually real treatment videos. I'm showing how I use ASTR instrument on the patient, and you can actually see the result in the video with the real treatment videos. If you are a healthcare provider, feel free to register for ASTR class so to learn how to actually treat your patient effectively. In ASTR class, I actually utilize over a 400 research study. That's actually what I use as part of the treatment, and that's what I will go over with a health practitioner to learn how to practice effectively based on research study. See you soon.